Good afternoon. We're here with Humboldt County Health Officer Dr. Teresa Frankovich for the September 18th media availability. Thanks for being with us.
Thank you.
The North Coast News asks, Governor Gavin Newsom signed 2 bills to protect essential workers during the COVID-19 pandemic. Under AB 685, employers must report an outbreak to local public health officials, and they must also report known cases to employees who may have been exposed to COVID-19 within 1 business day. He also signed AB 1867, legislation that immediately ensured access to paid sick leave for every California employee. How could these bills impact the pandemic here locally?
Well, I'm happy to see the legislation. I think it really just helps to create some fail-safe mechanisms around case investigations. So you can imagine that in a county where they're, because of the number of cases and how much they're dealing with in terms of volume, that they may not be able to do as aggressive case investigation as we're able to do here to date. And so having that other way in which health department can get information about cases occurring in the workplace is particularly helpful. And so in our instance, typically when we identify a case, obviously we're talking to that case quickly, we're finding out where they work, and then we're able to look at the workplace as a place of possible transmission pretty quickly. But it's great that there's that reassurance that if for some reason we weren't able to reach someone or they weren't forthcoming about their employment, there is another mechanism for us to learn about that situation potentially. So I think that's great. And the fact that employers have to let their employees know if they're aware of a concern is also reassuring for employees. The last piece of this about paid sick leave I think is really important because we want people to be willing to come forward when they're sick, get tested when they're sick, and stay home when they're sick. And so having that assurance of continued pay is really important to families. So I'm thankful for that new legislation.
The North Coast News asks, looking at the daily testing data, the number of tests given daily has dropped below 200 a day this week. In previous weeks, testing was approaching almost 350 and higher per day. What is contributing to this decrease?
So for a number of weeks there, we had a really marked increase in demand in terms of testing. We had just multiple things occurring, including, for instance, HSU coming back in session and doing a lot of testing there. We had infections in healthcare workers in 2 different skilled nursing facilities. And when that occurs, we have to accelerate our surveillance testing and test the entire facility, patients and residents, weekly. So it puts, again, a huge increase in the testing volume needed within our lab. In fact, because of what's being seen across skilled nursing facilities across the state recently just put out guidance that says these facilities have to test their entire workforce weekly. As opposed to a little more spread out as we had been doing. And so we will be needing to help them comply with that. And so our volume is likely to tick up again as well. I do want to take the opportunity to point out, though, that in this instance for us locally, we had no secondary cases of COVID in residents of our skilled nursing facilities, which is amazing. The facilities did a wonderful job, and our public health team worked with them on that extensively as well. So kudos to everyone.
Thank you. The North Coast News asks, this week, Eureka City Schools made a decision to keep classes online, and some in the public lashed back in protest since they're allowed to reopen. Does our local health department believe all local schools are fit to go back to in-person instruction? And how do you weigh the impact to physical health against the impact to students' mental health?
Well, I think I'd be pretty safe in saying we'd all like to see children back in school overall. I think that's the optimal learning environment for them. That being said, our sort of message all along has been that in order for schools to open, they need to be able to do so safely under COVID guidelines. And we recognize that not all schools have the capacity to do that because of their particular facility. We also recognize that the desires in communities are different in terms of what the parents are looking for, whether it's distance learning or on-site learning. And there's also different capacities in the schools for the ability to offer robust distance and on-site learning at the same time. And sometimes this is dependent on grade level as well. And so, because we know that not all families are going to choose on-site learning. So I think there are a lot of factors that come into play in every school's decision about whether they can or cannot operate on-site. But we want to be supportive of them. And we'll help with testing and whatever else we can do for schools that are opening to on-site instruction.
Thank you. The redheaded black belt asks, currently the data noted for hospitals by county shows that Humboldt has 3 COVID patients in hospital beds. Would you agree that the public's general perception of the seriousness of the illness, as well as of the consequences of inaction in terms of prevention, is shaped and informed by what information is presented by experts and officials? If that is the case, do you think that giving the public a better idea of the current hospitalization rates would increase the public's awareness of the illness, thereby contributing to better public adherence of masking policies or physical distancing as examples of individual ways to mitigate spread of the disease?
Well, I like us being able to have information at our fingertips to make decisions. I think we've been trying to message really consistently and very frequently about what our current disease status is in the county. And we do an ongoing tally of hospitalizations that's evident really easily on our dashboard. So you're able to see if our hospitalizations have increased today by 1 or 2 or whatever when you look at that dashboard. The other thing I would say is that there is at the top of our dashboard a link to the state website. The hospitals all feed their data on their positive COVID patient inpatients, their ICU COVID patients to the state, and the state is actually making that available. In this instance, I would point out the difficulties sometimes with data that we face is that I will tell you that there are 2 patients currently hospitalized in our county for COVID. I think today the state website says 3. My guess is this person may have pulled that data point off perhaps yesterday, and so it's a moving target to make sure that we have an accurate number out there for the public on any given day. But I would encourage people who are interested in seeing a day-to-day count for ICU and regular hospital beds to just click on that link at the top of our dashboard, and they can have that information right in hand for every county in the state.
Thank you. The Redwood News asks, when it comes to the tier system laid out by the governor, you've talked about what it takes to bump us up a level. On the flip side, can you talk a little more about what needs to happen for us to decrease/drop down a level and loosen more restrictions?
I think that's a great question and a really nice positive focus on this. The next level down from us, the less restrictive tier is yellow. We're currently in orange, and to be in yellow, we would need to have basically a couple of things. We would need to have a case rate that was less than 1 per 100,000. That's over 7 days, a 7-day average with a 7-day lag. And on last measure, we were 3.9 for the state. So we're sandwiched here at, if we are 4 for a couple of weeks, we move into the red tier, more restrictive. If we can bring it under 1, then we move into the yellow, which is less restrictive and I think better for all of us. And so, these aren't, it doesn't feel like a huge gap in numbers, but it is in terms of actual day-to-day cases. So what I would tell people is that all the measures that we're talking about, the not gathering, the wearing masks, the social distancing, all are the things that help us nudge those numbers down. We actually, I'm sure people are aware, over the last couple of days, we've had just, a small number of cases after a relatively big influx over the end of last week and the weekend. And I credit the measures everybody is taking with that, the fact that we've been sort of able to sort of hold that line. And also for our CD team, our investigative team, which has been amazing. And again, these folks, we staff this 7 days a week. Oftentimes people are, 10 hours a day. They're following up on these cases regardless of when they pop up in our electronic system or in our lab, and quickly trying to isolate and quarantine individuals so we can contain spread. And it's those measures, although labor intensive, together with the public efforts, that I think are making the difference and allowing us to be where we are. So I think if we all, keep working on this and really adhere. I think obviously for most people the social piece has been one of the most difficult. But again, we just recommend the things that we've been saying all along, which is if you are going to mix with people outside your household, it's riskier just by doing that. If you do that, the safer ways to do that are small numbers of people, 4 to 6 people, not 20, 30, 40, 50 people. To do it outside, to do it masked and distanced. And using some of those features can help us minimize risk for additional spread of disease.
Thank you. The Redwood News asks, with Halloween getting closer, what do you think the holiday will look like this year? Does public health have guidance on how trick-or-treating can be done safely or other safe ways residents can celebrate? Can Halloween be done safely amid the COVID-19 pandemic?
So it's a good question, and we do have a little bit of planning time here, and we are talking to sort of local business, community, and cities to sort of try and think of ways that we might be able to offer something a little more structured that would be safer. Obviously, door-to-door trick-or-treating across multiple households intuitively doesn't seem like a good idea. And so, but that's obviously a big tradition for Halloween. So are there ways that we can operate more safely with Halloween this year? A few things that come to mind are obviously things that you can do with your household unit and within, scavenger hunts or, little trick-or-treating things within your house for treats to, sort of get that feel for Halloween without being outside your home for that. Other things, going out, for instance, to eat. If there's a restaurant that's offering a Halloween kind of theme, can be something people can share together. But we'll, as we get closer to the holiday, we'll offer some suggestions for families. But I think it's up to all of us to get creative about how can we minimize mixing and still sort of embrace the idea and some of the fun of the holiday.
Thank you, and thank you for being with us today.
Thank you.